afternoon, Emma. How are you doing today? What an exciting time. I'm Rebecca, and I'll be your nurse today.
Hi, Rebecca. Nice to meet you.
Nice to meet you, Miss Wilson.
I've been feeling a little queasy lately.
Okay.
I have a few questions. I brought my mom along with me just to kind of see how it goes.
Okay, well, we're just going to start with some beginning procedures.
Wait, what are you going to do?
We're just going to take some vitals to make sure everything should be the way it should be.
Okay, sounds good.
We just need to do an extensive evaluation to make sure the baby's okay.
This is my first grandchild.
I understand.
Good thing my biceps are huge.
Okay. The blood pressure is a little high, but this is common among pregnant women. It could be a sign of preeclampsia, but we're just going to continue to check all the vitals to make sure everything else is okay.
Okay, so it's on the right track though?
Yeah.
Okay.
Yeah, we should be fine. Okay. Your vitals appear stable and everything is normal.
I'm so glad to hear that.
Now that I've finished taking your vitals, do you have any questions or any concerns or any symptoms you typically don't experience?
Well, I have been getting heartburn a lot lately. It hasn't been horrible, but it's just been in the past 2 weeks, and I've noticed that it gets really bad after I eat, and I just don't know if there's anything I can do to help that or what that's all about.
Yeah, heartburn's a normal symptom of pregnancy. Throughout pregnancy, the placenta produces the hormone progesterone, which is responsible for relaxing the esophagus from the stomach, which can allow gastric acids to seep back into your esophagus. This is what causes the burning feeling you've been experiencing.
Okay, so is there anything specific that I need to do moving forward to avoid this?
Yeah. I would stay away from carbonated drinks. Also be intentional about meal times. Try not to eat right before you go to bed.
Okay.
Oh my goodness, sweetie. I remember when you were in here, you were the most active little nugget. I had the worst nosebleeds, and you just would not stop kicking. Caused me the worst back pain. I'll tell you.
That's typical. Emma, have you felt the baby kick at all?
I have. I felt it kind of frequently. I was wondering, is today the day that I can find out if I'm having a boy or a girl?
That's correct. You're about 18 weeks along. This is typically the time we start to look for a gender on an ultrasound. Our 3D ultrasound technology offers a new approach other than the traditional ultrasound. We can talk through the benefits as if you'd like to consider it an option.
I would definitely like to consider it an option. I'm just kind of concerned. I'm not really informed about it. Is there any risks to this technology?
There are some, but they're minimal. I can have the nurse practitioner come in and tell you more about it if you'd like.
Okay, yeah, that'd be great because
We
I
think
know
that
about
sounds
this,
good.
You know, this
Okay,
new technology.
I'll get Mr.
stuff.
Nesto and send her in. She'll be excited to see you again, Emma.
Okay, thank you.
Hello, nice to see you again, Emma. How are you doing today?
Good, how are
Who
you?
have you brought with you?
This is my mom, Kaylee.
Hello, nice to
Hello.
meet you.
She likes to be involved in everything. She's kind of a crazy grandmother.
I heard that you have some questions about the 3D ultrasound technology.
Yeah, because I really don't want her to be hurt, you know, because we can't do that.
Absolutely, of course.
This is my first grandchild.
I understand. Well, the first thing you should know about this technology is that it provides much more information than on the status of the baby and lets me know if there's anything we need to worry about in the future. There are actually less risks in the long run with using this technology because we can spot anything that might indicate birth defects before they become too serious. The only unsure concern is that there is no certainty regarding the long-term effects on tissue, which is why we only perform these ultrasounds if we have a reason.
Okay, well.
Okay, so do you think there will be anything wrong? I am kind of concerned that my baby has birth defects because I've been Googling on WebMD and there's all sorts of things that can be wrong with your baby, and I'm just trying to have
So many.
Yes, of
nice
course.
baby.
Well, we're able to explore internal organs, make sure the heart looks okay. Basically, we can take any extra precautions that we see fit based on you and your family's medical history. We only are going to take this 3D ultrasound because your family seems to have some history of heart problems.
Oh, heavens, I forgot about that.
Yes, 3D ultrasounds aren't just performed because you feel like it, or if you want to see what the baby looks like. This technology is most commonly used in situations where there are possible risks for the baby's development. It can also help diagnose problems involving the face, spine, skeletal system, as well as cardiovascular and neuroimaging.
Okay, thank you so much.
Do you have any more questions for me, either of you?
I don't think so. I think you covered it all.
All
Make
right.
sure there's a happy, healthy baby in there.
Of course, I'll send Nurse Rebecca back in to show you the gender of the baby and make sure everything's all right.
Thank you.
Hey, Emma, are you ready for the 3D ultrasound?
Yeah.
Okay, so the nurse practitioner said that you had to be very educated to do this, so I really hope you're ready because this is my first grandchild in here.
I understand. As a nurse, I have to be very flexible and learn new things every day on the job. Information technology has been increasing in medicine and will only continue to become more advanced. I go through many training courses so that I'm able to properly communicate across all realms for health professionals concerned with you and your baby. I've done a lot of 3D ultrasounds before, so I'm familiar with the procedure.
Okay, that sounds great. Let's do the ultrasound.
All right, let me get this up.
I'm so excited. I'm gonna have a baby.
Girl or boy?
I don't know.
All right, let's get started. First, we're gonna put on some gel. It'll be a little cold. Gotta do this for the ultrasound. Okay.
I'm so
Now let's start doing our
excited.
scan. I'll bring the screen over here.
So high tech. Oh my goodness, Emma, there's your baby.
The baby looks very healthy with a strong heartbeat. Your charts have shown healthy heart development so far in your visits.
So does that mean there's nothing wrong and my pregnancy should be well?
I'll take a closer look at the heart, but it seems perfectly normal and on track with the development for this stage of the pregnancy.
Okay, so if everything's going well, can we know the sex of the baby?
Emma, are you ready? It's a girl.
Oh my goodness!
This is all I've wanted in life.
Another little Emma.
Of course, ladies. I'll do some extra looks in on the heart and contact you if there's any problems I find. Is there any other questions you have while you're here?
No, Rebecca, I just wanted to say thank you so much. I can't tell you how much this has meant to me and Emma.
Seriously, thank you so much. I'm so glad I got to have the 3D ultrasound and meet my little girl. I'm so
Yes.
excited. Thank you so much. It was so nice to
Yeah,
spend
keep
time
taking
with
your
you.
vitamins, take care of your heartburn, and I'll see you in a few weeks for another checkup.
Sounds good. I'm having a girl.
And then just start doing procedure stuff and then roll it over after.
Beautiful.
after.
Good.
Yeah, gel first and then we'll do it.
Got a wedgie.
Okay.
Ooh.
If I
This
put
mom has gotta be a pickin'.
If I have it here, can you